Okay, a very good afternoon to everyone present. I'm Soumya Tiwari. Am I audible, ma'am? Sir?
Yeah, yeah.
Yeah, you do. Yeah,
So,
clear.
on behalf of Newtown, Kolkata, I would be presenting on a solution that I have in front of me. So, it's essentially a solution that looks at solving the parking problem that existed in one of the preeminent healthcare facilities in the city of Newtown, Kolkata. So, as we all know, that the hospitals and healthcare centers that see a lot of people coming in from different parts of the city, and in fact, Tata Cancer Hospital, Tata Medical Center, as it's also known in Newtown, being one of the more famous and one of the best healthcare centers in the state of West Bengal, also sees a lot of uh, patients coming in from neighboring countries like Bangladesh and Myanmar as well. So the parking problem that existed within the facility is something that the authorities wanted to tackle, as as a lot of cancer patients used visit this facility, and it was very important that we did not have a situation where precious lives were lost because of a parking delay or things like that. So I'll just run you through my presentation, sir, ma'am. Um, we'll just look at what essentially the app-based smart parking solution in Newtown, Kolkata is all about. What the problem was that was needed to be addressed, and how exactly then we went about identifying the exact solution to the problem, and the process that entailed deploying this solution on the ground. Through the course of this presentation, we'll also look at a few of the factors that led to the excellence of this model and why it was so well acclaimed all across the city, and why citizens and in fact even the media was completely in praise of this initiative. So moving along, the first slide is on an introduction on what this app-based parking solution is all about. So this is something that was launched right in the middle of the pandemic. In fact, it was launched on in the middle of September, on September 15th, when the pandemic was at its peak. So it makes it all the more essential and all the more interesting that it was launched in a time when and social contactless payments and social distancing was the norm. So this app-based solution employs a sensor-based technology that essentially gives any user accurate information on the availability of parking slots within the area. Now, this plan has been thought of being taken across the whole length and breadth of Newtown, Kolkata, depending on how well it's received in other parts, and what kind of traffic solution or traffic problem exists at the certain place. So why did we need this app-based parking solution at all? So there were certain problems with the manual system that were existing at the Tata Cancer facility, which have been put into four broad categories. If we start from the first category, the most important thing that this parking delay or this parking hassle in times of manual parking pause was a delay in treatment. So as I said previously, Tata Cancer deals and caters to a lot of critical care patients. So delay in treatment for such patients is not something that we are essentially we are looking at. It's something that should be avoided at all costs. And someone losing their life just for the sake of not getting a parking slot is absolutely unforgivable. uh, Now, the unavailability of parking slots, would force citizens to drive around and look for alternate options available. This, as in turn, as we see on the third part or the third bucket of our problems, was that it would lead to extra consumption of fuel, because if it's a very natural tendency for you and me, if we travel to a certain place and we do not get a parking slot, we would essentially drive around trying to find a suitable parking slot. So there was a lot of unnecessary wastage of petrol that could easily be avoided. And finally, of course, there was a degree of harassment that was involved for the public because, as I said, that you have families that are bringing in their loved ones in on a lot of occasions who are in need of critical care. So undergoing the hassle of looking for a parking slot is not something that would be liked by anyone. So what exactly was the solution about? So the solution that the Newtown Kolkata Smart City authorities came up with was that we could install geosensors in these parking slots. So that was essentially what was done. So the parking slots were installed with geosensors, which then transferred data to the app, which could be accessed very easily via any Android device. Now, these sensors uh, would essentially pick up information on the availability of the parking slot. So when there's a car parked in a particular slot, if I go onto the app, I'll see that that parking slot is not available. But the moment that car leaves that parking slot, the app gets updated and I see a vacant slot available at Tata Medical Center. Now, for this solution, a minimum reservation fee is levied as parking charge, and motorists can book a slot in advance by paying that fee. Now, let's look at this simple process in a very simplified and illustrative manner. So, for example, any citizen might look for a parking outside the Tata hospital. So there's a car that seeks parking on the Tata hospital. So the driver or the owner can easily check the availability of the slot on the app or on the site well in advance. So we have it's a decision point. So based on the results that the user sees on the app, if it's a yes, if there's a parking slot that's available, he can easily get to the center, park his car successfully, and then move on with the other formalities that he has at the Tata Medical Center. Now, in case a parking slot is not available, the facility is completely jam packed. It's not an issue because he has the option of trying again for a different time slot if he wants to visit the facility on the same day, or if he has got some other engagement that cannot wait, he can very easily make a booking for the next day. So, summarizing this entire thing, what we essentially came up with was that motor vehicles and their owners, they could choose a slot in advance. They could arrive at the place at a designated time at of their choosing without any issue, without any hassle. In case of unavailability of a parking slot, an alternate time could be selected by them without any problem at all. So this entire solution essentially aimed to increase the convenience for patients by curbing unregulated parking. Now, the excellence factor that this solution has, and it's something that I mentioned at the start of our presentation. So, what exactly is interesting about this solution that we have in Newtown? So, the framework that this solution hinges upon is that it this was the brainchild of the smart city, the HITCO, and the Newtown Kolkata Development Authorities. Uh, we received a lot of feedback from citizens on the difficulties that they were facing, while getting to a preeminent healthcare facility that like Tata Medical Center. We took those opinions into account. We took the survey results and put them into different buckets, different time zones, and we realized that yes, there was an issue that needed to be addressed. And since Newtown is a smart city, why not do it with the help of technology? So we decided to leverage technology to solve this parking related issue uh, you know uh, that was there in our city. So what who exactly is this solution going to benefit? To be honest, this is a benefit that has been envisaged to provide relief not just to the satellite city of Newtown, Kolkata, but to all citizens of Kolkata. Uh, as I said, that this is a preeminent center of excellent healthcare facility in the state of West Bengal, and it sees several patients coming in from neighboring countries like Bangladesh, Nepal, and Myanmar as well. So, providing these foreigners as well as our own citizens the best healthcare facilities along with the best parking facilities, was something that we took upon ourselves as a matter of great pride. So, what have we achieved ever since the implementation of this technology based parking? So, the easy availability of parking has translated into 1,636 bookings since September of 2020 when the initiative was launched. For any citizen, any person who wants to get to the facility, he can take stock of the availability of the parking slot just by pressing a button on his smartphone. It prevents wastage of time, it's extremely efficient, and it has enabled authorities to, crack down on any sort of what how should I say, misadventure of parking authorities, of local, parking people who used to extract a fare from the patients who were, used to maybe give in to their demands because of the emergency that they found themselves in. Ever since this technology based parking has been introduced, the average daily parking fee collection has been hovering around 628 rupees per day at the facility. Now, this is some of the feedback that we've received on the project and
Sorry to
how.
interrupt you, sir. Sorry to interrupt you. Could you please conclude your presentation?
Yes, I am wrapping up. Just give me a moment, and in a minute, I'll wrap it up. This is some feedback of citizens in Newtown who have said that this is a great initiative that Newtown has come up with, and how it's been really useful to them. This is a mention of Newtown's contactless parking in times of COVID, in times when people don't want to get in touch, get come in touch, come close to one another. Social distancing is the norm. So this is where we've been quoted. We've been quoted on the Times of India. This technology has found mention in the Telegraph for its contactless and absolutely convenient method of parking solutions. Uh, Thank you so much for your patient hearing. I hope you liked our solution at Newtown. Thank you so much.
Jury members.
So this is a very practical solution for a is an emerging problem of parking across the country, and so also in particular for Kolkata and the important hospital. Hello, am I audible?
Yes, sir, you are.
Oh, okay. Now, okay. Uh, See, this solution that you have developed, it's going to help not only others but to the in the community places also across the country, because parking is a perennial problem now, and it's everywhere. But the solution you developed is very what I may say is that very good in terms of easy way of application of digital technology and making life easy for a person who wants to park a car in the time of crisis and critical conditions. So this is what it is. But you see, if somebody finds a slot, then if he, how long he can stay there? I mean, there must be time limit. Suppose comes there and parks for eternity, then it becomes a problem. And number two is that suppose a person, if such a thing is not available, like the technology you applied, if there is a space not available, a person in absence of your technology like that, he will be hunting for a unicorn, like the place never exists. So this has given a great solution for that. So, and what is the demand and supply side and accommodation side from your, how do you balance that? You are not able to, with given the slots of parking, what is the demand for the parking? So are you able to balance these two?
Yes, sir. So, as you very rightly said, the demand and supply economics of it is something that we needed to look at. Naturally, in the beginning, the people were a little hesitant because they weren't very sure of how to use this and how exactly they could get there. But over the course of these 6 months, a lot of these initial hiccups have actually been ironed out. People now, the biggest thing is that people know about this initiative, so they now know that they can go onto the app, get a slot book, and as you very rightly said, sir, that you were talking about the time slot. So essentially, the time slots available that are there. So based on how long you park for, you get charged proportionately. So if you park for, say, for 30 to say 45 minutes, then you will get charged at something, you will get charged for a rate that is pegged at under 1 hour. And if that charge, it goes beyond 1 hour if the car is parked over there, so that fare
that
proportionately
that
increases.
that that aspect needs to be rationalized, because the people may be ready to park their car for eternity, come may what cost it may be. But there are people who are in a dire need of a parking in a, while bringing a critical patient. So there
Right.
should be some kind of rationalization. Then suppose a car is parked for a longer time,
Hmm.
and it is depriving a very critical patient, the space. Then there should be some communication between the long time parking car owner to vacate it, to provide this thing. This app applies, provide that provision.
Yes, sir. So as you very rightly said, sir, so in that case, what happens is that anyone can obviously, book a parking slot. But because of the simple fact that the parking slots are present within the premises of Tata Medical Center,
Mm.
everyone that goes in has to show, certificate or a doctor's appointment. So that's the first thing. And the second thing, so anyone who's actually using the slot, sir, has to be someone who's visiting the facility at Tata Medical Center. So someone who's going somewhere else cannot park his car over there. So that's
No,
the first
even
thing. It's
even in the hospital, a visitor may come with giving whatever required certification that he is attending to a critical patient or whatever. But if it stays unduly longer time, then it becomes a difficult situation for you to say no to a person who actually needs very urgently.
yes, sir.
So that's one aspect. Number thing is that you've done a great solution not only for the hospital they're working, but a idea that needs to be adopted everywhere. Are you thinking of putting this in an enterprise mode, this app, so that it applies everywhere and you can take up in a larger scale?
Yes, sir, absolutely. As I also had mentioned in one of my earlier slides towards that this is an idea that we are looking to take to all parts of Newton. But since when we were launching this entire idea and this technology, we wanted to provide solutions in an area that was most in need of it. So there was no better area to start our intervention in
Absolutely.
compared to the medical center at the peak of the pandemic, and that's the reason. But using this app, we are also looking at parking, app-based parking solutions in different prominent malls of Newtown as well. So Newtown has got a lot of prominent malls like Access Mall and Central Mall that see a lot of footfall, especially on weekends. So these are also places where this technology will be implemented. In fact, it's already in progress as well. So this is essentially the larger scale up plan of this app-based parking solution. So the idea is to make parking in a phase wise manner. Obviously everything won't happen within a few days, but the overarching approach is to have a phase wise approach wherein we make parking in Newtown completely contactless. A, because we believe in technology makes people's lives better, and given that we are living in the middle of a pandemic where people want to practice social distancing and do not want too much of transaction in cash, cashless transactions, cashless economy is the way ahead. So that's what our plan for the city is.
Thank you. Excellent. Madam, आपके
If somebody makes a reservation in advance for a parking slot, so how long that reservation is valid? Like I book it for 3 o'clock, and I'm, as you know, Kolkata traffic and all that. I reach by 3:10. What happens to that slot?
So for that, ma'am, there's a certain penalty fee that is levied. So in case you make it to the slot, as you said, ma'am, that you are booking it for say the 3 to 3:45 p.m. slot. So that, as you very rightly said, given Kolkata's traffic, it's very likely that someone might land up late, and wouldn't make it in time. But the simple fact is that so that grace period that is given is for around 15 to 20 minutes, because
Okay.
in that
All
case,
right.
although
And then I reach there and I find that my slot is there is no slot. That can happen because somebody has overstayed its time. He's ready to pay, but he has booked for half an hour but stayed for an hour. So my
Mhm.
slot is gone. Then what
Right.
happens? I have already paid for it. What happens then? My reservation.
Ma'am, in case you make a reservation and it's booked, that place stays booked for you for the total duration. But since this is a very big facility, what the other provision that we have is that we have not, precisely for the reason that you are saying, and precisely for the reason that sir also pointed out, we have kept a number of slots as buffer. What
Okay.
happens in
So that
case,
is taken care. So that is
exactly,
taken
it's
care. If
taken
I
care of.
book, I get it. All right.
Yes.
Now the numbers you showed. So that this is quite fine. Only thing is in the last slide when you showed about your achievements
Mhm.
and the numbers you showed, you said something like since September, that is now almost 6 months,
6 months.
1636 bookings had happened with a
Yes.
collection of 628 rupees.
Mhm.
So these numbers are very low.
Yes, ma'am. So
So that
this
means they
is
have not become popular so far.
no, they are, ma'am. But I'll tell you what the thing is that this 628 rupees that I mentioned at the bottom. So, before this app-based system being introduced, there was really no way of knowing how much was getting collected in the parking account. So that is one
No,
improvement
no,
that we.
that is not true because they must have contracted out to some parking operator and there
Yes.
must be some kind of a lease. So they
Yes.
must be knowing definitely. The point is they may be getting something and something else must be paid. That's a different thing. But 628 rupees per day collection, parking fees collection in a big hospital, it's too low.
Yes, ma'am. So, as you said, ma'am, since most of the people, a lot of people who come there are not very technology savvy, and it is something that takes time to grow on people. So even this 628 rupees is something that we have come up over 6 months. So what happens on a lot of occasions is, ma'am, that there are people who land up and who are unable to use the app, right, at the facilities. So in that.
No, somehow, somewhere that is not really cutting ice because these days people, especially those who are in Calcutta, if you say that they don't know how to use an app, I can't really. But anyway, that's the reality.
No,
So
no, they do, ma'am.
let's go. Let's go. Okay, thank you.
Okay.
I'm not very convinced, but it's okay.